Thank you all for joining. This is our second quarterly update of the year. So the first quarter of the calendar year, third quarter of our fiscal year. Just wanted to kind of give you an update on what's happening between January and March of this year. As always, we like to lead with our mission. It's the reason we're all here in this Zoom room. The reason the foundation was created almost 25 years ago is to advance medical research, promote disease awareness, and provide support and education to people who are affected by scleroderma in the US. And I know that everyone here joins us in that mission, and look forward to sharing with you how we're moving the needle in each of these areas today. So under our first mission pillar of support, if you look at just how many support group meetings have happened just in the first 10 weeks really of the new year, 115 groups have met, and that is virtual, which is really incredible and allows for great accessibility for all of our people across the country to be able to join in. We'll highlight a few of those here on the next slide, but really, really incredible peer-to-peer support happening there. And thank you to all of our support group leaders and our SPIN-SLED training groups as well, going through training. We have a great active online community called Inspire. And if you haven't joined, I would encourage you to do that. That's just another great outlet for some peer-to-peer support online. And so I know there's a lot of, we have a lot of Facebook groups and chapter Facebook pages and all of that. And it's really great to interact that way. Inspire is really cool because you can really identify any topic that you want to talk to other people who are affected by scleroderma about, whether it's a specific type, a specific symptom, what medications are working for you. It's a really cool community and it's growing every day. You can see just in the first quarter, we've had 415 new members join the online community, which is really incredible. And I mentioned SPIN-SLED. We have a new class going through training right now, and this is required for all of our support group leaders, just making sure that they have the resources they need to adequately support those in their groups across the country. And so we have 13 leaders currently enrolled in that cohort. And then we have all of our graduates who participate in monthly meetings as well. And so we have 55 participants in those monthly meetings. So really incredible work happening under that support aim of our mission, and really grateful to everyone that's involved in moving that forward. One of the unintended consequences that's actually been really, really great of COVID is that, all of our support groups had been largely geographic. And one of the cool things that happened when we moved to virtual is there was an opportunity for groups to identify themes or topics, since they could meet with anyone across the country and start to build groups out based on similarities or things they had in common and wanted to dive into a little bit deeper. So I wanted to highlight 3 of those here. One of those is our BIPOC support group for Black, Indigenous, and people of color. And they just had a great session on the 13th, so just a few days ago, with Lucy Wong, who's an incredible veteran artist, and talked about creativity and art and how powerful those are. And that's been a big theme actually this month, I think. Everyone's been sharing a lot about kind of art therapy and just how helpful that can be. And I know Lucille Miller in Ohio did something, just really cool to see that happening. Another group is our bilingual group. So our Spanish and English speakers have a group, and they had a great session with Samantha Leon here also earlier this month, looking at digital ulcers and scleroderma. And then we also have a great group of men, and while scleroderma may only affect 20%, or 20% of people affected by scleroderma are men, it's a great group that gets together and they're able to share, what that experience is like for them. And they meet the 4th Wednesday of the month at 7 p.m. and you can register on our website, and they actually have their March meeting coming up next week. So I would encourage you to check that out if that's something you would be interested in. But this is just, again, a highlight of some of the important work that's going on in our support groups. Under our education pillar, we recently did a webinar with ATS on palliative care in scleroderma. We had 150 registrants for that, and that recording is up and available for you. We've had great success in resharing the videos of our Spanish language educational videos, and so 2,100 views of those videos, and that helps us inform our programming. So that's really helpful. Numbers speak for themselves for us to know that we need to do more of that. Our chapters did 4 educational events just in the last 10 weeks, and I'll highlight a couple of those for you. And then we also did a webinar on factors of social determinants that influence health disparities and had 92 participants for that. So I mentioned that our chapters are already up and running for the calendar year in terms of putting on their educational events. And so one that's really well known is from our South Carolina chapter. And so this was their 12th annual Susan K. Parrish Scleroderma Conference. And it was virtual again this year. And they had 3 one-hour educational sessions, great faculty from Medical University of South Carolina and Clemson and others. And I'm sorry, I think Dr. Hant is actually from Clemson, and I've tagged her incorrectly there. But the recordings are available on the chapter's YouTube page, and I would encourage you to check those out. Really great sessions. And one of the highlights is certainly Dr. Hant on COVID-19 and scleroderma. So grateful to the chapter for putting on another stellar event and for sharing those resources with the community. Another chapter that recently held their educational summit is our Rocky Mountain chapter. They had 125 participants, which is really incredible. Also 3 one-hour blocks of education, and they have their recordings available on the chapter YouTube channel as well. So you have access to this wealth of information and education. I wanted to highlight one session that sounds just really cool. Definitely going to check this one out. And Maria was kind enough to share it with our team earlier this week. But Dr. Kilborn from UC Denver and Anna Seaman presented together on helping kids cope when a parent lives with chronic illness. And so Dr. Kilborn able to provide the perspective from, the physician caregiver side, and then Anna able to provide, her experience having her mom being diagnosed when she was 6 years old and what that was like and how she was able to support her, and some kind of tips for others that are going through similar things. So really cool highlight there. Encourage you to check that out. Again, grateful to the chapter for putting this on and sharing these resources. Which brings me to our national educational resources. I am delighted to share that this year's conference will again be virtual. While we do look forward to the day that we can all be again face-to-face and in person and in the same room together, we're very cognizant of the health and safety of our population. And we're also really excited that this will be accessible to everyone. So we're working to get us back face-to-face, but still want to be really cautious this year and excited to do some really cool things virtually with everyone. Have a lot of great education planned for you. All of the usual suspects, but also some new and exciting things. So of course we'll have, organ involvement, what disease progression looks like, what to expect as a newly diagnosed patient, GI and nutrition, Scleroderma 101, self-care, how to manage your own health and taking care of yourself, how to be an advocate for your own health, and so much more. And then of course we have our poster hall that'll showcase the current research that's being done, and look forward to having you all there. We'll have more information on our website shortly, but really excited to see you all there in July. So moving to our research pillar of our mission, you all know that the board approved $2.4 million in new research grants. I'm going to share with you some of the highlights, a few highlights of those grants that were funded. The new issue of The Voice will be hitting your mailboxes soon, and those projects have been announced. So you'll see headshots and abstracts for those funded projects from these investigators who were selected. Since 2020, we've approved 3 new designated research and treatment centers, and that may seem like a small number, but it's great to see that we're getting designated scleroderma research and treatment centers, and one of those is actually a PEDS program, so really exciting to see that. I think this number is growing every day, but our global research webinar continues to be a really great draw for the global research community, and so we have just under 200 registrants for April 1st session, and that number is ticking up every day, and you can register on our website for that. And I mentioned I wanted to highlight just a few of our new class of investigators whose projects are starting this year. So kind of just going left to right here with me, you can see we have Dr. Chakraborty at Boston University, and he was selected as the Marta Marks Fund for the Eradication of Scleroderma Award. So these named awardees are selected as very prestigious. When the study section reviews the grants, they select the best to be named as these named awards in each category. So this is a really big deal and really exciting. So Dr. Chakraborty is looking at the role of lymphatic ERG deficiency on pulmonary fibrosis. Janet Poole at University of New Mexico is the recipient of the Mark Flappen Award, and she's looking at feasibility and acceptability of the Making It Work program for systemic sclerosis. Our 2022 recipient of the Walter and Marie Coyle Award is Patrizia Fuciotti at University of Pittsburgh, and she's looking at molecular mechanisms of CXCL13+ positive, T-cell B-cell interactions in inflammatory scleroderma skin lesions. And then finally, our newest named award, the Deborah Lurvy Memorial Research Grant Award, has been awarded to Robert Lafiatis at the University of Pittsburgh. And he's looking at cooperative transcription factor regulation of myofibroblast differentiation, easy for me to say, and systemic sclerosis associated ILD, so interstitial lung disease. So you can see there's just in these 4 named awards, kind of the cream of the crop here. There's a wide breadth in the type of research that's being done, from organ involvement, basic science, to more outcomes research, and even some translational research. So really, really exciting. Just to pick a few more, wanted to highlight some of our new investigators and established investigators. So 2 of our new investigator awards this year. One goes to Deanna Baker Frost, who many of you will recognize and is a frequent speaker for us, and she's at the Medical University of South Carolina. She's looking at the role of estradiol production in systemic sclerosis. And then we have Sean Fortier at Michigan, looking at lung and skin myofibroblast dedifferentiation and fibrosis resolution in systemic sclerosis. And then 2 established investigator awards, one to Hopkins University, Monica Mukherjee. She's looking at echocardiographic risk prediction of mildly elevated pulmonary pressures in systemic sclerosis. And then we have an investigator at Rochester Institute of Technology, Karen Wirtz-Kozak, and she is looking at a novel 3D skin model to test therapeutic TRPC6 modulation. So again, a really great variety in terms of the type of science that's being funded. New investigators, established investigators all across the country at prestigious academic centers. And again, a good mix of basic translational and clinical research, and even moving toward that outcome and patient intervention side of things. So really exciting to see. There's more in the spring issue of The Voice where you can read some details about this, and then we'll be highlighting them throughout the year as well. We move on to awareness and advocacy. Wanted to share, we'll share a little bit about our brand launch, which we shared with you in January, but just between when we look at Q2, which would be September through December of last year, just ahead of the brand launch, and then after we launched, we've seen a 75% increase in web visits, which tells us we're doing something right. We've seen over 700,000 impressions on social media during our launch period. And then switching more to the advocacy side of things, saw great engagement from the community. So thank you to everyone who participated in that. 706 letters sent in response to our action alert earlier this year, and 85 Senate offices were reached through that. So thank you all for participating in that. A little bit more about the brand launch. Hopefully you saw the big splash in January. Did a press release that was picked up several places. Of course, pushed our video out, several videos out on social media and YouTube to share about, the breadth of what we're doing, that we really are national in scope, that all of us together are making a great impact and in service of people affected by scleroderma. We also were able to do a small VIP brand launch ahead of Southeast Florida's Stepping Out Walk in February. And so that was really great to be with the chapter and of course to be able to enjoy their great weather so that we could do it outdoors safely. But really great to start to share our new values, brand promises, new name and logo and look with the community. So hopefully everyone's had a chance to kind of navigate through the website. We really did design it to be very user-friendly, but we're always happy to walk you through and help you find anything on the new site that you may have trouble finding. If you kind of knew where it was on the old site or got used to that, we're happy to kind of show you where it lives on the new site. We are launching phase 2 next month. So this will really be refreshing the chapter homepages, making them look as nice as the rest of the website and giving them the functionality of including news items and events and things like that. We're also expanding our main navigation. You can see there was certain placeholders for healthcare professionals. We'll be able to expand that a little bit more so that people in our audience will be able to find what they're looking for. So you'll see that rolling out and hopefully give even more functionality and utility to the site. And of course, what makes all of this happen is the incredible culture of philanthropy in our community. So thank you to all of our supporters who help make possible what we do every day. In fiscal year 22, just so far, so we're just a little over halfway through, you all have raised $2.86 million in support of the mission. So congratulations, thank you all so much. We've seen a 23% increase in funds raised for the month of December when we look at 2020 versus 2021. I will show you kind of what it looks like fiscal year to fiscal year on the next slide. We didn't do a big push for Rare Disease Week, but we just wanted to see kind of what the community raised during that time. And you all brought in $9,000, which is really great. And then, of course, we're grateful to our corporate sponsors and donors as well. And we've secured $67,000 in corporate grants through their generous contributions to fund our CME programs. So thank you to our corporate donors as well. When we look at our revenue for this fiscal year versus last fiscal year, this is at mid-year, so as of December 31st of each year, you can see that we're ahead in every category. So even in special events, which is down because of COVID and we're not able to have as many, we're really seeing an increase. And so really grateful for that. You know, some things like bequests can't be expected, but grateful for everyone who includes us in their estate plans. And if you have questions about that, we're always happy to walk you through that and what that looks like. But the takeaway here is it's good news. The community has really stepped up and our efforts in building infrastructure in our philanthropy team are really starting to pay off. So really grateful to see that in action. All of this, of course, allows us to support our community and our chapters and the programs and services that we provide all across the country. And so just taking a snapshot of kind of chapter engagement in the first quarter, you all know we have 19 chapters across the US. Last year, those chapters hosted more than 40 stepping out walks, which is really incredible considering the environment that we're in with the pandemic. 15 educational events were hosted by those 19 chapters. And then of course, we have 160 support groups available to our community. And congratulations to the Southeast Florida chapter. They kicked off our walk season with the first Stepping Out to Cure Scleroderma Walk of the Year. They raised over $49,000. They held their walk at the end of February. Again, the weather was absolutely incredible, and Fern Robin and Arnie Brownstein and their team just did an amazing job. They had nearly 200 attendees, which again, for the first time having a walk after a couple of years of not, is really, really incredible. And I know, you know, it can be discouraging sometimes in the community when you expect larger numbers from, you know, the before times. It's really, really encouraging, I think, to see these kind of numbers coming in now. So we had lots of teams participating, which is really cool. Then we also had national sponsor volunteers come down to be a part of the walk. Some of our national staff on site, which was really fun, and then lots of support group leaders present as well. And these are just some photos from the day. Again, really great engagement from the community. Great team, Marty and his family and friends driving up, or driving up, I think, from Key West to honor his daughter Carmen, and that team alone raising $25,000, which is just really incredible. But you can see lots of teams here supporting their family and their loved ones, and just a really, really great day. So congratulations again to that chapter, and looking forward to all of our chapters walks throughout the year. And if you are looking to find a walk near you, you can go to our website, scleroderma.org/stepping-out, and find a walk near you. So finally, I want to turn to our financial health. As stakeholders in the foundation, you all are investing in the future and want to share with you how that return on investment is going. As of the end of February, we had $2.4 million in cash. And then we also, of course, hold investments, and wanted to share with you the fair market value of those investments, which is sitting at just under $10 million. Some of that is our reserves. And so we do calculate how many months we have in reserve. So if we didn't raise another dollar, how long would the foundation be able to continue its programs and services? So almost 2 years, 23 months. And then when we look at our revenue for July through February, for just the national organization and our national chapters, we're at $2.6 million. So these are preliminary February numbers, but again, really encouraging, really strong balance sheet, and really excited to share these numbers with you all. So with that, I am happy to open it up for any questions. I am going to stop the share so I can see everyone's faces. And if anyone has questions about anything, happy to go back and elaborate on that. While everyone's getting a minute to kind of think of questions, we do have Greg Lurvy on, so we'll just say thank you so much for your investment in the foundation, and so excited to have a named award this year for you.
I have a question.
Yes.
Hi. I was wondering if you could talk about any research that's being funded for kids with scleroderma, or any specific programs for kids.
Absolutely. So we do have some research that's being funded in juvenile scleroderma. The board committed actually a specific dollar amount to draw new investigators in to apply for that. We didn't see as many applications as we would like to see in that category. So I think that's something we'll continue to promote, to try to get investigators interested in looking at that area, and specifically, in our program. I don't have in front of me what the funded grants are, but happy to share that with you offline. And then, of course, we do have, in terms of educational programming for parents of children, and then we have the youth and adolescents support group as well. And then we have the Kids Get Scleroderma 2 conference, which, when we're face-to-face, that's typically held, in conjunction with the National Scleroderma Conference in the summer. But when we hold that virtually, we're able to kind of separate that out and have that as its own distinct event, which has been really successful. So those are a few of the highlights in the PEDS area. We're also working to build out that section of our website to make it more user-friendly.
Great, thank you.
I'm just going to make a note to follow up with you. Any other questions? Or anything anyone wants to know more about?
Hi, this is Mary Condit. This is my first time doing any of this. I just signed up a couple weeks ago. Is there somewhere that you could talk to other people? I'm going into my 3rd year of scleroderma. And is there any way to talk to other people, one-on-one or in a group, who to kind of know what to expect, things that I'm going through now and who else has gone through these things?
Absolutely. So Mary, I would recommend one of our support groups, and we can follow up with you. I've taken a note of your name, but we can follow up with you about maybe which one would be the best for you in your time zone. They're all virtual right now. When we move back to face-to-face, of course, that's an option as well to find one in your community. But one of the nice things about them being virtual right now is you can kind of hop on one that's convenient for you. And that's really the best place to connect peer-to-peer and share those experiences. And then we can also connect you with a support group leader or a chapter leader in your area to connect you with a peer to have one-on-one conversations as well, because really that peer-to-peer experience is what we find to be so valuable. And Marilyn, you're a great support group advocate and leader. Do you want to add anything to that?
I concur with everything Mary just said. The support group leaders are here to support any information that you may need, and we provide an excellent atmosphere, welcoming atmosphere for you to come and feel comfortable to share, information relative to your journey, and also hear about other members' journeys as well. So welcome to the Scleroderma family. Welcome to the Scleroderma community.
Thank you.
We'll get you plugged in.
Yeah, he's probably supposed to be a phone call. He's going to tell me on this.
Great. Well, if there are no more questions, I will not keep you all. I know that was kind of fast and furious, but we'll put the recording up online. I am a notoriously fast talker, so apologies.
Oh, I do have one more question. You were talking about money. I mean, like from somebody, you said some donations. How do you do that? I mean, to belong to the foundation, do you have to donate, or what's that all about?
Yeah, so there's no cost associated with any of our programs and services. They're available to anyone in the community free of charge, but we are supported purely by donations. So all of our funding comes from donations from individuals or from corporations or from private foundations. Or grants. And so we rely on the generosity of our donors to fulfill our mission. And we work with them one-on-one, donors who are interested in having an impact or leaving a family legacy or honoring a loved one. We work with them to be able to establish something in their honor, in their name, and happy to talk to you more about what that could look like. But yeah, Greg and his family have obviously done that, and it's been very meaningful for them and for us. To be able to honor their loved one.
Awesome. Okay.
Thank you for asking that.
Mary,
Yes.
maybe she might want to know about the memberships, like our regular memberships.
Absolutely. So we do have membership available, and there are some specific perks associated with that. We can send you some information on that as well.
Okay.
But essentially it's $25 to join. And so you get member only access to, archived issues of our magazine. You get a print copy of our magazine and different things like that, discounts on our conference and other things, but happy to send you a link to those resources as well.
Oh,
So
that would be great.
yeah, great. We're so glad to have you here and so glad to get you plugged into the community. I think Steve is going to get your contact information through chat, and we'll make sure that we connect you with all of those resources. Jenny will definitely follow up with the research that we're supporting in juvenile scleroderma. And then, of course, happy to chat with you further about, kind of what's being supported in the community on a larger scale as well through NIH and other places. But really important work, and we're glad to see a greater investment there across the board. So it's moving slowly but surely, but we're trying to attract more people to that for sure. Well, I just want to thank you all so much for taking time out of your afternoon to be here and to learn more about your investment in the foundation and what that's contributing to. We can't do anything we do without you and without your support, without your volunteerism, and again, without your support and donation. So thank you all so much. Hope you have a good afternoon, and we'll look forward to seeing you around soon.
Thank you.
Thank you, guys.